Hello, everyone. Thank you very much for being here. I want to start by acknowledging that Stanford sits on the ancestral land of the Ohlone tribe. This land was and continues to be of great importance to the Ohlone people. Consistent with our values of community and inclusion, we have a responsibility to acknowledge, honor, and make visible the university's relationship to Native peoples. My name is Michael Mastrandrea, and I am the research director of the Climate and Energy Policy Program, which is part of Stanford's Woods Institute for the Environment. The Woods Institute is a founding pillar of the Stanford Doerr School of Sustainability and is celebrating 20 years of sustainability leadership, bringing together scholars from across Stanford to advance understanding and develop practical, just solutions to pressing environmental problems. The Climate and Energy Policy Program combines interdisciplinary research with direct policy engagement, serving as a practical, timely, and neutral voice informing decision-making on climate and energy law and regulation. Today, we will be discussing the upward trend in nitrate levels in Central Valley groundwater, its link to dairy manure, and subsequent health concerns. First, Gina Hervey, who is a legal fellow with the Sustainable and Humane Food Systems team of the Climate and Energy Policy Program and the Stanford Law School's Environmental and Natural Resources Law and Policy Program, will discuss the impact dairies have on nitrate in Central Valley groundwater and well water, nitrate's human health impacts, and our response to a recent state effort addressing these issues. Next, a panel of experts in geophysics, human health, and environmental justice will discuss these issues, as well as the history of dairy manure management in the Central Valley. The panel will be moderated by Michael Wara, director of the Climate and Energy Policy Program. There will be an opportunity for questions from the audience during the panel, so please submit your questions using the Zoom Q&A feature, and we will get to as many of them as possible. And now it's my pleasure to hand it over to Gina.
Good afternoon, everyone, and thank you for joining us for our webinar, Elevated and Dangerous, the Health Implications of High Nitrate in Central Valley Well Water. So first, a brief overview of today's webinar. I'll be discussing a little bit of context about California dairies. We'll then discuss the dairy's impact on groundwater nitrate, high nitrate public health concerns, and the state's newest draft dairy order in response to these concerns, and subsequently our comment letter response to this draft dairy order. So first, a little bit of context about California dairies. They're a major part of our economy. For reference, in 2021, dairy was California's leading commodity in cash receipts. Milk production grossed around $7.6 billion. In the map here, you can see those red dots are all the dairies with water permits in the Central Valley. And as you can see, they're heavily clustered in a few regions. Indeed, the Central Valley is home to approximately 89% of California's cows and 81% of our dairies. As you can imagine, that many cows produces quite a bit of manure, all heavily concentrated in one place. Indeed, one cow produces almost 170 times more waste than humans, and there are approximately 1.6 million cows in the Central Valley alone. And as you may know, manure contains quite a bit of nitrogen. One dairy cow is estimated to produce at least half a pound to a pound of nitrogen a day. And this has become a growing contaminant in our groundwaters and thus folks' private domestic wells and tap water. In part, given these groundwater nitrate concerns, the state commissioned UC Davis's nitrate study, which first came out in 2013 and again in 2017. Perhaps unsurprisingly, this study showed that dairy manure does play a significant role in groundwater nitrate. Among other things, the report found that dairy manure now accounts for 1/3 of all nitrogen applied to agricultural lands in the southern half of the Central Valley. That's second only to synthetic nitrogen fertilizer land application, and that's that blue wedge you see there in the pie graph. And furthermore, the report found that annual manure application rates on some crops most commonly fertilized with manure can have more than 4 times the amount of nitrogen that the state actually recommends these crops need for optimal growth. And unfortunately, domestic well nitrate concentrations in the Central Valley continue trending up. This video that I'll play in a moment here shows how nitrate levels in different zip codes have increased over time. The video begins in 1995 and ends in 2019. So as you'll see, well water samples in a zip code that had 5 to 10 milligrams per liter of nitrate turn orange. Those zip codes turn orange. And when they measured over 10 milligrams per liter of nitrate, the zip codes turn red. The darker colors indicate that at least 3 well water samples in that zip code exceeded that 10 milligram per liter level. And the lighter colors mean that only 1 or 2 wells reached that level. Indeed, based on the most recent unique well water samples in the state's data set, almost 83% of tested domestic wells in the Central Valley have nitrate above the 10 milligram per liter federal maximum contaminant level. In this map here, you'll see the pink shaded area is the Central Valley Regional Water District, and the red dots are all the well water samples in that district that are over that 10 milligram per liter threshold. But perhaps even more concerning is that the Water Board recognizes that near dairies, these levels of nitrate are upwards of 48 milligrams per liter, so well over that 10 milligram per liter threshold that the federal government sets as a high indication of human harm. And to take a step back and to discuss this directly, why does all this high nitrate matter? Because high nitrate consumption can lead to serious human health impacts. One of the most well-known, though very rare conditions, is called infantile methemoglobinemia, or more commonly, blue baby syndrome. This is what the FDA referenced when setting that maximum contaminant level to 10 milligrams per liter. And infantile methemoglobinemia happens when too much nitrate is absorbed into the bloodstream, and by oxidizing hemoglobin into methemoglobin prevents oxygen transport. When the bloodstream is less able to supply oxygen to tissues, babies turn a bluish gray, and in severe, untreated cases, can die. And our community partners have explained that growing up near dairies, you're told not to drink the water for risk of blue baby syndrome. You're recommended not to use kitchen tap water and certainly not for washing baby bottles. Children in schools can't use the drinking fountains. And at the same time, there are stories of blue baby syndrome in isolated communities near, for instance, almond fields where there's a significant amount of manure land application, or on dairy farms that are reliant on well water. Furthermore, numerous health effects are related to ingesting high levels of nitrate, even below that federal maximum contaminant level of 10 milligrams per liter. This is one example of a 2018 literature review of over 40 studies exploring the impact of drinking water nitrate on different human health impacts. And it concluded that high nitrate levels in drinking water are consistently associated with increased risk of colorectal cancer, thyroid disease, and central nervous system birth defects, among others. And I also wanted to highlight this 2021 study by Stanford researchers that found in California, while pregnant, each milligram per liter increase in tap water nitrate concentration increases the likelihood of a preterm birth by about 1.5%. So now that we've established dairy manure's role in rising nitrate levels and high nitrates public health concerns, we're now going to turn to one way the state has attempted to address this problem, and that is its latest draft dairy order. The state has long attempted to address dairy's impact on water, long before the 2013 petition for regulation on this slide's timeline. However, this latest draft dairy order is the Water Board's most recent regulatory action and attempt to restructure how dairy manure is managed. It also provided a timely opportunity for our team to comment and submit a new preliminary study regarding blue baby syndrome and its most predominant symptom, cyanotic attacks, which I'll discuss in a moment. Ideally, the state plans to run workshops and discuss the dairy order and any comments related to it, and then submit a final dairy order by mid-2016. Next, I'm going to briefly discuss the preliminary study our comment letter shared with the State Water Board. So the preliminary study found that in some instances, high well water nitrate occurs in zip codes with high cyanotic attack billing codes. Now, to clarify, a cyanotic attack is a single instance of bluish skin discoloration, and it can have many causes, one being too much nitrogen. Blue baby syndrome only occurs when there are repeated and prolonged cyanotic attacks due to elevated nitrogen. That being said, researchers found some zip codes that have both high well water nitrate and high cyanotic attack counts. These maps, two examples of Central Valley counties that the researchers explored, mapped 2011 to 2019 well water samples with each zip code's aggregated count of cyanotic attack billing codes. And as you can see, well samples in general miss significant portions of these counties. But perhaps more alarming, there are several areas where the black dots, those wells that are at 10 milligram per liter of nitrate or higher, are located in the same zip codes where some of the most cyanotic attack billing codes occur, those zip codes that are a dark red. If nothing else, these preliminary findings warrant a deeper dive into why these cyanotic attacks occurred in the chance that it is indeed linked to high nitrate ingestion. Notably, the best data available to researchers is nonetheless indirect, which makes quantifying impacts difficult. Specifically in this research, scientists were using Medi-Cal recipient billing codes for cyanotic attacks. And this indicates that a doctor likely looked into that condition, not that they formally diagnosed it. Thus, it could contribute to an overcount of the true number of cases occurring. At the same time, Medi-Cal data only represents about 38% of the California population. So in that way, it could undercount the true number of cases. Furthermore, the newborn cyanotic attack code misses high-risk babies 29 days to 6 months old because it only applies to babies 0 to 28 days old, but babies are considered high risk up to that 6-month mark. And lastly, some babies may have been coded under an adult beneficiary's account rather than their own because it takes time to create a new beneficiary record. So if a baby's come in sick but doesn't have their own ID yet, a parent's might be used instead. And so when looking for IDs for cases for those within that high risk range, those babies wouldn't show up. Furthermore, scientists used the most comprehensive well water data available, which comes from the Groundwater Ambient Monitoring and Assessment, or GAMMA, state program. Unfortunately, the GAMMA data set is an incomplete picture of domestic well water quality. This map shows all the wells tested for nitrate in the Central Valley that's available in the GAMMA data set. However, according to a geospatial study in 2015, it's likely missing nitrate data on over 75% of California's domestic wells. That's approximately 67,000 wells. And furthermore, the most recent nitrate well samples for most of those wells is over 15 years old, with some of them over 80 years old. And as you can see from this graph, the data used to inform policy and risk management is quite lacking. Now, to reiterate, while an incomplete picture, it is the best available to scientists and policymakers at the moment, and as I've discussed prior, and nonetheless indicates a worrying upward trend in nitrate concentrations, particularly in the Central Valley. Because we know that despite incomplete data, that there are a rising number of wells in the Central Valley with elevated nitrate, we know that ingesting too much nitrate can cause severe health effects, and that even the risk of these public health effects has a very real impact on quality of life, especially near dairies. We submitted our comment letter. Most critically, our letter urges the State Board to expeditiously ensure safe drinking water to high-risk communities and not wait until mid-2016 when the dairy order is finalized. Specifically, We recommend more thorough and updated well water testing, prioritized collaboration across programs, especially those already meant to provide clean drinking water to at-risk communities, such as the CV Salts program and others, which we won't touch on in this presentation, but are worth looking into. And lastly, to expedite community education and clean drinking water access. So to conclude, a few key takeaways from this presentation are one, that dairy is a major California industry with 89% of California's cows based in the Central Valley. That dairy cow manure is a major source of groundwater nitrate in the Central Valley, and that domestic well water nitrate levels continue to rise. There are many severe human health effects linked to nitrate overconsumption, and in conclusion, the state should expedite comprehensive well water testing, nitrate risk education, and safe drinking water access. Thank you for listening, and now I'll pass it on to Michael Wara for the panel discussion.
Thank you, Gina. That was a great introduction to the issue, and we're going to have a panel discussion today. From a variety where we'll have a conversation initially with a number of experts that really come from different perspectives, from the medical field, from the geoscience field, and also from environmental justice, share an environmental justice perspective that's really, where the engaged with the issue directly with communities in the San Joaquin Valley. So it's a great panel. Our first panelist is David Stevenson. Dr. Stevenson, I should say, is the Harold Faber Professor of Pediatrics, and by courtesy of OB-GYN and of anesthesiology at Stanford Medicine. We also have Jenny Sakali, who's an associate professor of geophysics and a senior fellow by courtesy at the Woods Institute for the Environment. And we have Seth Alston, who leads efforts at Leadership Council for Justice and Accountability related to issues around dairies in the San Joaquin Valley. And I just want to welcome all three panelists to the conversation and lead off with David, just to ask you, David, to talk about share your perspective on issues around blue baby syndrome and concerns with that Gina just presented around nitrate contamination in the San Joaquin Valley associated with these large dairies. What are the risks? How might those risks play out? And what do we know about, or what might we hypothesize about clinical effects in newborns from the data and some of the preliminary data that you just saw?
Thank you, Michael. Gina gave a really nice review of the potential dangers. I think it's important for people to understand that it is a real danger. It's not something that people are inventing for the purpose of changing policy. Just to remind people, hemoglobin is the molecule that carries oxygen to tissues. And for hemoglobin to bind reversibly to oxygen, the heme iron must be in what's called the ferrous form, or iron 2+ state. And as a red blood cell circulates, it is exposed to various oxidants, and in this case, potentially nitrates coming from this water source. And oxyhemoglobin can be oxidized to what's called methemoglobin, which is basically hemoglobin in the ferric state, or the 3+ state. And essentially what's happened is that the molecule's been oxidized and it's lost an electron. Well, why is this important to babies? Well, babies are more sensitive to oxidants, the ingestion of nitrates that get converted to nitrites by gut bacteria. They have a transient enzyme deficiency called cytochrome B5 or methemoglobin reductase, and they have a lower cytochrome B5 level, which is an electron donor, which can recover the methemoglobin back to oxyhemoglobin. So unlike adults that can do this quite efficiently, babies for the first several months of life don't have that system working as well yet. And so oftentimes the methemoglobin levels can go very, very high. And if they get to the high levels, like 20 or 30% of the hemoglobin is in the methemoglobin form, adequate oxygen cannot be delivered to tissue. And it also interferes with our ability to measure saturations. And so saturations, although they may be even more extreme than this, will level off at about 85% based on the tools we use for measurement, even though when we measure oxygen in the blood, it'll be in a normal range. So it can be quite confusing for physicians that are not thinking about this. So it's a very dangerous situation if you can't carry oxygen and deliver it to tissues. And that's what babies are facing.
Thank you. Jenny, could you speak a little bit about, how much we know regarding the situation in the groundwater in the Central Valley, and how this relates to what communities may experience in terms of potable water supplies?
Yeah, absolutely. I'm happy to weigh in. So I should maybe clarify, I'm a geophysicist, so I look at, we think about water, we think about, natural systems and how they're changing, but we also work with communities to reduce risk that they're facing. And I think, first of all, thank you everyone for joining this webinar. I'm glad you're here. I'm glad we're talking about this because I do think it's a very important topic. I think a challenge for us is groundwater pollution has been rising for quite some time. And what's important, I think, to keep in mind when you look at the kind of data that Gina has presented is that this is a problem that has been getting worse for several decades. So we see, as you might remember from the movie, a lot of areas in the Central Valley now where the water contains very significant portions of nitrate. And the FDA imposed this 10 milligram per liter threshold, but really the values we're seeing in some domestic wells that are represented in the data set, which again isn't all of them, and I think that's very important to keep in mind, that we're multiple factors above that. And so the risk that Gina mentioned about health complications, of course, depends on the concentration, right? So it's not just a question of whether you're above the threshold or not. It's also how far above the threshold are you? And safe drinking water supply, I think, is crucial, for communities, particularly, like for young babies, as, Dr. Stevenson explained, who are particularly at risk, but also for pregnant mothers, for a lot of us. And what worries me sometimes is that, yes, we can replace some of the drinking water with bottled water, but also we need to think about how we use this water in other ways. So, for example, if we wash our cookware in this water, some of the nitrate might retain on it. If we use it to cook soups, we might still ingest some of that water. So I think it's a really important question and one that I hope together we can get ahead of.
Thank you, Jenny. Seth, you're engaged directly with communities that have to confront this challenge and live adjacent to the dairies in the San Joaquin Valley, and in this broader context of agriculture-related pollution that does affect the groundwater. And as Gina's data showed, dairies are a part of this. They're not the only thing going on, obviously. But how do you think about this problem from a community engagement perspective? What are the steps? Ultimately, we want to protect people. That's the most important thing. We want to make sure that every baby that's born in California can grow up and be healthy and not worry about the water that they are consuming or that their mother is consuming. What is your experience with sort of engagement on the issue in the San Joaquin Valley with communities, and also kind of the prospects for solutions being implemented faster rather than in the long run?
Yeah, thank you, Michael. And, thank you to my co-panelists for the really useful context. As Gina, stated in the opening slides, in a lot of communities where nitrate contamination is known to be an issue, there's kind of a conventional wisdom around avoiding the tap water, and especially when people might be using a domestic well where they have some sense of what the contamination level is like, they can make that choice. But these problems also impact communities that use, small community water systems. And maybe in those cases, people have slightly less of a clear sense of the quality of the water that they're getting. But still, we know that people are aware of this issue because they live in proximity to the dairies or other irrigated agricultural operations where nitrate discharges are a problem, and that people at the household level are really bearing the costs associated with it. So people, who avoid their tap water are going to have to seek replacement water, or to, forego the use of water from their tap for certain domestic uses. And ideally, those kinds of costs would be shared across the whole water ecosystem in the area. We know that dischargers have a role, and of course, regulators. Going forward, we'd like to see more protective discharge limits to try to mitigate this problem. It's really been an issue that's decades in the making, and only recently have we seen a turn towards more aggressive implementation of regulations. And still, there's a too much of a focus, I think, on short-term interim solutions rather than pivoting towards long-term sustainable approaches that will resolve these issues that we're seeing for folks.
I want to ask a follow. Thank you, Seth. That was great. I want to ask a follow-up question for Jenny to respond to, and then perhaps you could respond as well, Seth. Which is that there's sort of a short-term response, which might be involve providing alternative sources of water to vulnerable populations that are adjacent, that are in the area. There's a longer-term approach that involves reducing additions of nitrate and other compounds associated with manure and fertilizer to the groundwater. Jenny, how fast might we expect nitrate concentrations in groundwater to change if we were to say, significantly limit nitrate additions to the system, or even to eliminate them? Is that something that would happen quickly, or is it something that would take a while? And I'll just stop there. That's a first question.
Yeah, great question. So I think one thing I want to say before I go into that is it's important to keep in mind that once groundwater is polluted, it's very difficult to clean that up again, right? So I think we are partially facing the problem that we currently have a lot of nitrate that is still entering the water, but we also have a lot of nitrate that has already entered the water, right? So in my personal opinion, I think it's really important that we get ahead of this problem at some point. When you look at the data, you do see very significant variations in the nitrate concentrations, right? So the groundwater the concentrations do vary with extreme rainfall events or other factors. So it's certainly not constant, but the trend overall is increasing. And in terms of the timescales, I think you would see some benefits immediately, right? So the water, the nitrate that is not entering the system is, it's helpful for less water, for less nitrate to enter the system at any point in time, right? So that definitely is already a win. The time it would take for that to actually be measured or measurable in domestic wells does take some time. It depends on the depth of the well, and it depends on, where this water is entering the wells. One thing that's really, I think, interesting about the patterns of nitrate concentration we see in the Central Valley is, as you might remember from the movie initially shown, it's quite a widespread problem now, right? So yes, it is higher in the vicinity of dairies, but it's certainly high everywhere at this point. So I think it also depends on how close you are to the pollution source. So if you limit pollution in the vicinity of these sources immediately, you would see more of a benefit there. It will take longer for that benefit to propagate to communities that are a little further downstream. But I think there is a value in acting immediately because ultimately it benefits everyone.
So in essence, what I'm hearing you say is when you're in a hole, the first thing you have to do is stop digging, right? And that makes a ton of sense. And then there's a longer term question about how do we fill in the hole that we've dug ourselves into. Seth, how do you think about that kind of prioritization, or is your perspective both and, which would be a very reasonable thing to say from the perspective of the communities that confront this challenge, this risk? Do you see prospects for both better short-term protection now and a change in practice that would allow long-term recovery of the groundwater to make it safe to drink again? Or is the solution really to move people onto centralized systems where there's kind of centralized filtration to make sure that they aren't exposed?
Well, I think it's both and right. We'd like to see steps being taken immediately to reduce the application of manure as a fertilizer or synthetic fertilizers that are far above agronomic rates that are causing discharges to groundwater that are endangering people's health. We would like to see short-term solutions like replacement water and well testing become comprehensively available in the affected areas. And, depending on local conditions, other long-term solutions like system consolidation or service extension, well replacement might be necessary. It's not necessarily that we're going to be able to return every single domestic well to water quality that's protective of public health. I think the goals really depend on local conditions and what makes sense for the particular community.
I want to pivot now to asking you a question, David. So one of the things that's a struggle in all of this, and you see this in Gina's presentation at the beginning, is just data availability is a real challenge. And understanding what the water quality is in the wells is a challenge. Understanding, because we have limited information, understanding and interpreting the types of medical code data that are kind of core to this suggestive evidence is a bit of a challenge. As a clinician who spent their career working with lots of babies, what would you see as kind of the next logical step in terms of evidence gathering that we could undertake to better understand and characterize the degree of this problem in the San Joaquin Valley or in the Central Valley?
I think my colleagues have, described that pretty well. I mean, there are short-term and there are long-term approaches. I think short-term is probably most important from my perspective, to make sure that the public is educated about the potential danger, particularly in babies over the first several months of life. There may be, again, other adverse effects of nitrates that can affect adults if they're exposed continuously for long periods of time. But adults have pretty efficient systems for basically reconverting methemoglobin. You have to remember that the nitrates that are produced in your gut are oxidizing, and they can cause other kinds of problems, as were noted. So I would think, besides the approaches that were described, I'd say the most important one from my perspective would be educating the public about alternatives to drinking from wells where they may have uncertainty or actually know that they are contaminated with nitrates, and providing a water that is safe to drink. If they're mixing up formulas, say some powder formula, something of that sort, then they should be careful what the source of water is. And I would encourage breastfeeding for the younger infants at the very least, because there really haven't been cases of methemoglobinemia that have been serious in the context of breastfeeding. Nitrates do get into breast milk. There's no question about that, but the levels are typically lower, and they're not likely to cause the problems if the baby were drinking the water directly, or the water is being used to mix formulations and things of that sort. So I would say educating the public about alternative sources of water that should be supplied to these individuals, and then educating healthcare professionals about what to look for, because they're not going to see this condition very often. Hopefully, not at all, and it is preventable. So if you can just, have people be aware that this is a potential problem, and they confront a baby that's having this kind of cyanosis, there are treatments, and they are very, very effective in most individuals and can correct the problem very easily. And doctors know how to do that once they make the diagnosis correctly.
Thanks. A question about groundwater in the Central Valley. So a big policy initiative since the multi-year drought that we experienced in the last decade is the Sustainable Groundwater Management Act and the implementation of SGMA. And part of that, or a significant amount of that, was motivated by falling water tables in the Central Valley and subsidence associated with that. Does that affect this problem at all? This is really a question from the audience, but I'm just going to pick it up because I think it's relevant. How does the sort of overall situation with groundwater management affect nitrate concentrations that might be experienced in some of these shallow wells? Jenny, do you want to take that?
Sure, happy to. So yeah, I mean, we have a groundwater problem in the Central Valley, no doubt about it. And that is related to, but also in addition to the nitrate problem we have, right? Like, so we are not managing groundwater in a sustainable way. And there are lots of issues that creates, like the subsidence problem that you're mentioning, right? And it is challenging to get ahead of that. Like, it's one thing that we struggle with as modelers is really trying to track, for example, where nitrate is going when it is being released to the natural system. And partly the subsidence problem makes this more difficult because as the earth subsides, some rocks get very compact, and that changes the water routing, right? Like, so the water isn't routing in the same way anymore as it had previously. And it's very difficult to track that because we have very limited data on it. So we're increasingly creating sort of water pathways in the subsurface through which, like nitrate gets to places that are not close to dairies, or where, we see a very significant decrease in the water table. So yeah, it's definitely an additional challenge. I think it's important to keep in mind that many domestic wells are quite shallow, right? Like, so a lot of the subsidence that we're seeing happens much deeper than where we're actually pulling this water from for most domestic wells. So it's partially occurring. It's partially a process that happens at a different depth. But of course, it's related in the sense that we are not thinking very carefully at the moment about how to allocate or how to manage groundwater in the Central Valley.
Seth, are there straightforward approaches for community members to understand their own degree of risk at the tap? Like, is there an easy way, or is this largely a word of mouth? Given the socioeconomic situation for many of the folks that are impacted by California residents who are impacted by this issue, is there an affordable way to test water to understand whether this is in fact an issue for someone or not in a community or at a well? Is that testing typically done, to your knowledge? Like, what is the degree of kind of information that that folks have in the communities in which you work?
Right. So as we saw in the opening slides, there are data gaps in some of the resources that we have looking at well water quality throughout the state. More recently, there have been efforts to implement no-cost well testing in some areas of the Central Valley that are particularly have a particularly high risk of this kind of nitrate contamination. So, in those contexts, at least, what we're advocating for is more extensive outreach, um, comprehensive well testing in the communities, trying to make it so that there's less of a barrier for folks that would like to know what the quality of their domestic water is. In some places, there are, maybe are issues with local trust. If we know that the programs are being implemented by agricultural industry groups, there's, maybe it's hard for local residents to overcome a distrust of the entities that they might consider responsible for the kinds of contamination that they're seeing. But going forward, we hope to increase the availability of the free testing so that nobody has to guess or go off of the kind of conventional wisdom, word of mouth that you're alluding to.
I'm going to ask you an additional question, if you don't mind, which is that, and I'm sort of shifting here, or I'm already sort of gradually shifting into questions that are coming from the audience, which I really appreciate, and please keep them coming. But we've seen some questions about like, well, how could the dairy industry behave differently? If we have a large concentration, would it be by a fundamental change in the nature of the large dairies, which if you have a lot of cows in one place, they are going to generate a lot of manure. That just follows from having many, many cows concentrated in a single place. Or are there ways to manage the manure that will improve environmental outcomes for the communities that surround the dairies? Or is it a mixture of both things that has to happen to solve the long-term problem?
I do think that it'll be a little bit of both. I mean, we've already seen changes in the industry over time towards consolidation, towards increasing herd sizes in a smaller number of dairies. So those kinds of changes responding to market conditions are changing the way that this problem expresses itself. But ultimately, we do need better practices in manure management and in more agronomic application of manure as a fertilizer, whether it's in the lands surrounding dairies or ultimately if we can see the maturing of some kind of market for distributing dairy waste in lieu of synthetic fertilizer. But that's kind of speculative at this point. What we're seeing in the San Joaquin Valley dairies is that even though we're aware of problems stemming from, say, manure lagoons where manure is impounded in ponds on site, there's a reluctance to implement requirements for lining and other things that we think of as low-hanging fruit or kind of common sense approaches to changing the way that dairy waste is handled in these places.
I just want to ask a follow-up question that I realize is a little bit crazy, or maybe it's not crazy, but how different is the way that we handle animal waste at a confined animal feeding operation from how we handle human waste? We are also animals at sewage treatment plants.
I mean, in most of these places, there isn't anything close to what we would see for the level of treatment of municipal sewage. So it is essentially just a byproduct of the dairy production process, and then maybe a raw material that goes into fertilization. But there is some lining of some areas to prevent infiltration, but for the most part, it's nothing close to the way that we consider human waste to be hazardous and treated in our centralized processes.
So just to make that clear, if you are the sewage treatment plant in Bakersfield, you have one set of rules. But if you're a confined animal feeding operation 10 miles down the road, you have a completely different set of rules, even though the thing that you're treating is more or less, they're closely related, right? Solid waste from a mammal. But the different sets of rules apply, and that leads to different outcomes in the world. Is that fair? And in general, the rules around human waste are quite a bit stricter.
And I mean, for many decades, there was almost an absence of regulation of dairy waste. So it's not even a different set of rules, but we're seeing a lack of any rules at all for a long time.
Thank you. I just wanted to make sure that was clearly stated in this conversation. I appreciate you laying that out for us. I want to ask the three of you the same question, and this is one it's coming from the audience and in different ways. Multiple people have asked this question. If you had one additional piece of information at very high quality, if you could measure one thing, just backing up, it's hard to improve things that you don't measure. If you don't have basic information, it's very hard to understand the level of the problem, how much you want to invest in the problem, and the right way to address it. We're in a situation with this problem where we have some suggestive data from which we may draw some inferences, but we're pretty far from knowing for sure what is, or we have a ways to go to be certain about, for example, the degree of blue baby syndrome that's occurring in populations in the Central Valley. But we have some very suggestive evidence from which to draw inferences. What would you like to see if you could measure one thing and know it with some high degree of accuracy and precision? What would that one thing be related to this problem? I'll start with you, David.
Well, for me, that would be basically any baby that presents with cyanosis, and we heard that there are many different causes, that they measure the methemoglobin. And there are technologies in existence for doing that in every hospital. So rather than not knowing, it'd be better to know if in fact it exists. And if it exists, it's treatable. And not only is that useful in terms of understanding the magnitude of the problem that we may be facing because of this contamination, which is a matter of fact, I think the most important thing is that we can treat these babies and protect them, and they wouldn't have to then suffer the consequences of having severe methemoglobinemia and hypoxia at the tissue level. So measurement of methemoglobinemia.
That makes tons of sense. Jenny, what do you think? What would you like to know that you don't know yet?
I mean, I should say, I work in risk, right? And I don't think there is any such thing as knowing for sure, ever. Like, I don't think that's a reasonable goal. I also don't think we need it, right? Like, I think in this case, we know quite a bit. Yes, I mean, we don't know everything, but do we ever know everything, right? Like, I make decisions on a daily basis in which I have less information than on this one, right? Like, so I think I understand that it would be nice to have more information, but I think we have enough information to clearly identify what needs to happen here, right? In terms of, if I had one thing that could be measured, I'm probably with David on this one, right? Like, so I think just really understanding, protecting, like infant health, like as a mom of 3 kids, right? I think protecting infant health to me is what resonates most with me in this. I think to me, it's an acceptable outcome to even not know that one, right? But generally speaking, I think it's really important. I would prefer that we get away from the storyline of like, oh, we don't know everything. I'm like, yeah, well, I mean, welcome to the real world, right? Like, do you ever know everything, right? Like, no. So yes, I mean, would it be nice to have more wells tested? Yes. Would it be nice to like have more insight into, infant health? All of these things are good things, right? But I don't think we need them to clarify that there's an issue here, right? Like, I think just looking at the nitrates level going through the roof, if you continue on that trajectory, the impacts will get worse. I mean, we know enough about medicine to know that, pollution is a question of doses, right? And if the doses gets continuously higher, then yep, I mean, we should get ready for what the consequences are. And so, maybe that's the perspective of someone who thinks a lot about, what could happen before it's happening. But I think there's a huge value in just acknowledging that we know enough to act, and we should act based on the information we have alone.
Seth, what would you like to know? Or you agree with Jenny that we know enough?
Yeah, Jenny made it easy for me. I didn't want to be the only one to fight the question, but of course it would be good to have more domestic well data. It would be nice to have a more complete understanding of the land application practices, but essentially, I agree that more aggressive action is reasonable right now in response to the presently available evidence of these risks that we have, and that we are sort of in a treadmill of planning to make a plan, and part of that is the idea that there could be a complete picture if we just gather more data. But I agree that for the time being, we have enough to make an inference of risk, and that we should be responding to that risk in a different way than we are.
So I want to ask you, or I'll ask the group, and all of you can answer if you want to. We're getting a number of questions kind of about what does the change need to look like? Is there, and a related question is, are there models for large scale agricultural systems that look different and better than what the systems that are causing this pollution problem in the Central Valley? Like, are there dairies elsewhere in the United States or in the world that operate in a different way, manage their waste better, and are able to operate profitably and produce the products that people want from them? Like, because I think it's always helpful if we sort of say that's what we want. We don't want this, but we also need to say this is the thing that we would prefer. What's your thought? Do you have thoughts on that? Any of the panelists, feel free to. It's tough. I mean, this is a hard question. Is it the concentration? Is it the scale? How might that affect Jenny? Go for it.
Yeah. So I'm running up against the limits of my knowledge here, right? Like, I'm not someone who is deeply into dairy and how these CAFOs are run, or like how these, concentrated animal feeding operations or dairies, how they're organized. So I don't know the technology side of it. I don't know the management side of this. I often get questions like this, like, again, like we work on risks, and we often get this question, could we do it better? And I think the answer is, of course we can, right? Like, so we have unprecedented technology, we have unprecedented data, we are very creative, we have good ideas. I think I can't give you the definitive answer on that, partly because I think I would love for us to discuss that with big dairy or dairy owners. I think they hold that knowledge, and I would love for them to be part of that conversation. So I don't see it as my role to say this is what should happen, but I think, maybe I'm an optimist enough to say, we can send, we can send a robot to the moon. How can we not get a handle on poop? I mean, I just don't think that's conceivable in my mind. That's my take on it.
Seth, do you want to weigh in, or David?
Yeah, I'll say quickly that, I don't know if there are global examples that we can point to as perfect alternatives. I know that nitrate groundwater contamination is a global problem, and ideally with a change in the regulatory framework, something that incentivizes the industry to change practices, we might develop best practices that can come out of the San Joaquin Valley and be applicable elsewhere, even if we can't point to solutions from other places that will work in this particular context.
I guess I would say that sanitation was one of the the greatest advances in the history of medicine. And if we figured it out for us, we should be able to figure it out for cows. And I do think that nitrogen in the environment is a really important issue to address. It has other problems that are health-related in nature. For example, cholera. You think about Bangladesh and places like that. So these are much larger problems, but I think they're solvable. I think we know what the solutions are. Oftentimes, it'll come down to money. So I would suggest that besides the farmers and the dairy farmers and so forth, we probably need economists to help us think through how to do these things as well.
Well, one of the things we're interested in understanding are, at least, and this is something that our team is working on, is the economic subsidies, the implicit subsidies associated with milk production at large dairies and also beef production. Because I agree with you, David, and a lot of this does come down to cost and the politics of food in this country and the desire to have very inexpensive food. And not to say that we shouldn't have inexpensive food that everyone should be able to afford so they can have healthy, nutritious, delicious meals, but we also need to find ways to do that don't harm populations that are adjacent to the production areas. Does anyone have a closing thought that they would like people to take away from this hour of their time? And I think, with regard to the problem of dairies, I want to give you each an opportunity just to give a closing comment. David, maybe we'll start with you. So maybe you've just given it, but I'd love to hear if you have a closing thought as people think about this issue and the problem of public health in these areas around large dairies.
I think because the contamination is real, then I would urge the public to become, well, they're not listening now, but I urge people to become educated about this and physicians to be cognizant of the problem and look for it and treat it to help the people who are affected right now until we solve the problem at a larger scale.
That's great. Jenny, do you want to close with a thought?
I guess my closing thought would be for everyone who is on the call to maybe think about your ideas of how we can move forward on this problem. I think it is clearly a problem. I agree with David, right? Like sanitation is not rocket science. We can figure this out. And how can we move forward with this as people who care about both the economy and the pricing that a lot of families are already struggling with, but also really the health of the people who are taking the burden right now. So maybe I encourage I guess final thought would be for all of you listening to take a moment to think about this. And if you have thoughts, send them our way. If you have ideas for getting engaged, get engaged. But I think it's up to all of us to figure this one out.
Yeah. Seth, you get the last word.
Well, I want to, thank everybody for participating and say that it's important to increase awareness of this issue, to focus closely on this issue. One consequence of the consolidation of the dairies in this state is that it's kind of out of sight, out of mind for many Californians. Los Angeles County used to be the major dairy producing county in the state, and now it's moved away from the large coastal metro areas. So it is easy to think that this is occurring in another California, that's sort of away from where many of us might be joining the call from. But just to keep in mind that this is occurring, it's serious, and to act accordingly, as a resident, as a voter, as a consumer. And I agree with Jenny, whatever thoughts people have might be part of the solution. So think creatively about it.
Well, I want to thank the three of you for participating in this webinar. I want to thank the audience for taking the time out of your day to listen in to Gina's presentation and to the conversation that followed, and wish all of you a good afternoon. And thank you on the behalf of the Climate and Energy Policy Program, the Woods Institute, and Stanford University. With that, we're going to wrap the webinar and have a lovely day.